Welcome back, viewers and subscribers. If you're new here, please make sure you subscribe and turn your post notification bell on. So our Prime Minister have adjusted the country on January 26th. Due to the rises of the coronavirus cases, she had to make some adjustment to the countries. Where restaurants and bars are closed, public transportation back to 60%. Markets and shops will be closed from February 3rd to February 17th. Basically, like we're going for a little lockdown, I must say. Banks are closed from February 3rd until February 10th. Curfew will begins from 7 p.m. to 6 a.m. Supermarkets will be remain open from 8 a.m. to 3 p.m. But the people are not here now. The people are still left out of the supermarket. But well. So basically, some of those things that is going to be happening for the next 2 weeks. Visitors from February 3rd must have a negative PCR test done 3 days prior to travel. Mandatory rapid test upon arrival. If negative, you go to a government authorized quarantine facility for 5 days. If positive, you go straight to the government quarantine facility. A number of flights to be reduced. Traces of new COVID-19 variants here. 3 cases so far. So from February 13th, all these measurements are put in place that I have been telling you about, and the Prime Minister said who can start the shopping, but the people them are overdo it. But I guess they have to do what they have to do. So people are gonna work from home and stuff like that. But wanna listen to what the Prime Minister have to say right now. Y'all don't forget to subscribe and stay tuned for more update from us. One love.
Good evening, fellow Barbadians, residents, and friends. I've done more listening, internalizing, and analyzing in the past 2 weeks than perhaps at any other period of my 30-plus years in public life. I've heard appeals made, I've witnessed directives given, I've seen measured responses as well, believe you me, as rash reactions. Only today, I met with and consulted with our social partners. I also met with the leader of the opposition and indeed the leader of the Democratic Labour Party and the former Minister of Finance as declared opposition interests in our country. I've met with our medical officials. I've met with the Barbados Association of Medical Practitioners. I've observed the functioning of our healthcare institutions and our healthcare practitioners firsthand. I've observed the trend of the spread of COVID-19 across our island. I popped into the hospitals and healthcare centers, but I spent a lot of time in the labs, as I told you on the last occasion. I've seen 1 or 2 hotels functioning. I've gone to supermarkets, hardware stores. I've been all over. And I've listened. I've watched and I've consulted. It is now my judgment that it is time for us as a people and as a nation to act. My solemn pledge to this country on being sworn into office as the leader was to seek out and seek after the interests and well-being of the citizens of this country. In the past 7 days, we have lost 3 of our people to COVID-19 in circumstances that have pained me greatly. They didn't break any law. They did not flagrantly abuse any protocol or guidelines. They did not even leave their homes. In fact, I've said that they didn't catch COVID. COVID caught them. None of the 3 of them went to COVID. COVID came to them. This has given me sleepless nights. And my fear is that COVID will not stop until we as a nation stop COVID. COVID will not stop unless we declare war on COVID. And in fact, I'd like to add to it, dengue. Our fight back, therefore, must intensify as of this evening. But my words will be empty if they were simply words. And therefore it needs more than that, the action and support of all right-thinking Barbadians in this battle. And it is for that reason that I started from yesterday consulting with the public health practitioners, with the EOC representations, with the Cabinet Subcommittee, with the Social Partnership today, with the opposition parties, and with diverse others people. I welcome and endorse the appeal by the President of the Barbados Association of Retired Persons in this paper today for seniors, for our elders in this country, to stay at home wherever practical and possible. You have heard me say so over and over because they are our most vulnerable group. I want to speak to you directly. You need to protect yourself. And importantly, I'm saying to you, we need to protect you. I want effective immediately, even before we get to the formal measures, for every Barbadian to understand that while I'm giving you notice of what we intend to do from next week, I want each of you to treat it as if you were looking at reducing your footprint, your interaction almost immediately. The country needs to pause. And to that extent, therefore, even though there are things that you will still be permitted to do and timelines that you may still have access to between now and the 3rd of February when the new measures will start, I'm asking as far as possible for you to treat it as if it was happening tomorrow. We're not doing it tomorrow because we're satisfied from experience and after consultation with all of the persons that I spoke to, that to do it suddenly will create a level of panic which will have more deleterious consequences than benefits to the nation. But having said that, to the extent that any one of you wants to join me, any one of you wants to join me and the others in ensuring that we reduce our footprint, then I say so start from tomorrow. Because it is one by one that will make that difference in terms of the risk as well as to the opportunity of the virus to find itself in somebody and to continue to use that person as a host to continue living. We are also going to require, we have already required since the beginning of this year, the mandatory wearing of masks in public buildings and public transport. We are going to require from the 3rd of February in our directives that the wearing of masks in public places shall be mandatory, unless in the case of individuals who are either alone or in the means of exercise or who around them have either a medical excuse or who are in the midst of speaking as I am, but you saw me start with my mask, you saw me take it off. When I finish speaking, I'm going to put it back on. So that we know, and we've heard from Drs. George and Bess and Drs. Ford, how having and wearing masks reduces our chances significantly. And I want to refer to the fact that many of the businesses that shut, believing that because one person had COVID in it, were able to ensure that they were able to reopen in quick order because in many instances protocols were followed. And once the protocols are followed, we know that you have at least an 80% chance of fighting off that invisible enemy, COVID. So I'm asking us, if we are walking on the streets and other people are in close proximity, wear your mask. If you are out in a public place, Lyman, and I hope that you're not doing much of that from next Wednesday when we talk, wear your mask. We accept that if you're exercising or if you are literally in the midst of speaking or if you have a medical reason and a letter from your medical practitioner, then that is a sufficient excuse that meets the directives that we have. But my friends, effective February 3rd, it shall be an offense not to wear a mask in public spaces as well. Has to continue. The Water Authority, the National Petroleum Corporation, the Light and Power, all of those are essential activities. The manufacturing entity dealing with feed for livestock, all of these are essential. But everything else that is not essential, we need to pause. We also are asking you immediately to get back to arming yourselves with the hand sanitizers as a way of life, all of us. And I'm saying to all the women out there, when you pick up your handbag, pick up your hand sanitizer. I'm saying to the men, when you pick up your cell phone, pick up your hand sanitizer. Let the cell phone and the hand sanitizer become a Siamese twin. Wash your hands and your face as often as possible. And you know why this is important? This morning I chaired for the WHO, World Health Organization, and the Food and Agricultural Organization, and the Plant Health Organization, and United Nations Environmental Program, a Global One Health initiative that I'm chairing with the Prime Minister of Bangladesh. And it is about fighting what we call the slow motion pandemic. I've said it to you, I think, before, that we are fighting those viruses that we get in hospitals and elsewhere, that the antibiotics are simply not curing anyway. And when we have had family that have died in the hospital because the antibiotics are no longer resolving the infections that they have, it is only going to get worse and worse and worse. But the one thing that point that was being made over and over by all of the experts on the panel for the 2 days for yesterday, and I'm sure it will come up again tomorrow, is that we need to make sure that people take proper steps to sanitize. It is so basic that it is almost frightening that is the strongest recurring message that we have to give to human beings across the world. And the problems that we will face from that don't only come from antibiotics, it comes from an overuse of disinfectant, it comes from an overuse of antifungals, antiviral medication, all of those things it comes from. So I'm saying, please, let us wash our hands and sanitize them as much as possible. I also want to make the point that effective tomorrow, I want to encourage you to plan out some shopping for the next 2 weeks if you can. And why? Because effective February 3rd, when we go into a period of advanced restrictions, pause, lockdown, call it whatever you want to call it, it's national stay home as far as possible, we are going to make sure that supermarkets will only be open for certain times, as I'm coming to. While we don't want you to go and rush at supermarkets, and I'm begging you now, we did it earlier in the year, you're not helping yourself, you're not helping the persons next to you. There's no need to panic. That is why we are not announcing anything tonight, but tomorrow or Saturday or Sunday. What we are saying to you is that we want us to plan out our business and to get ahead of this. We want to give our healthcare system and our healthcare professionals a chance to not only to fight this, but to win this battle. Because if they go out into the community without being able to do things, then they're going to have issues because there's simply not enough of them to deal with the persons who may be affected by the virus. This lockdown that we are calling, this pause, this national reset, is going to be necessary in order for us to give ourselves also a chance to go into the communities house by house by house and to do systematic household testing. And why? The doctors have represented to us that the earlier you plan, the earlier you can find persons in households who are symptomatic, the better their chance of recovery. One of the difficulties with the 3 persons who, for sure, the economy is going to be seriously affected. But as we discussed with the International Monetary Fund Fiscal Affairs Mission up to yesterday, we must spend what we will, we shall keep the receipts and be accountable, but what we are not going to do, as Madam Kristalina Georgieva has said over and over in my discussions with her, we will not sacrifice people at the altar of expediency or at the altar of simply trying to hold on to a dollar that is likely to be lost because of the level of deaths in the long run. My friends, join me in this effort. It is going to be a difficult few weeks, but I have every confidence that we shall use it for renewal, we shall use it for recommitment, we shall use it to be able to go in the houses and find the persons who need help, we shall use it to be able to ensure that we can strengthen our resolve and strengthen ourselves to make Barbados safe from COVID, from dengue, and to make you have the possibility of a bright future yet again.